Just waking up with us, we want to get you prepared for your morning with a look at 3 things you need to know. Right now, we know so many of you are struggling to afford groceries, and this morning, a food pantry in Matthews is hoping to fill that need. Starting at 9 this morning, the Crestdale Middle School Food Pantry will be open for families in need. The pantry is located on Sam Newell Road between Independence Boulevard and Matthews Township Parkway. Families in need can pick up food until noon, and this is the second week the food pantry has been open. If you head to Walmart for your groceries, you'll notice a change starting on Monday. The store will make all employees wear face masks. The company will test employees and then give them a mask. Right now, customers don't have to wear masks, but Walmart is suggesting that if you go inside, to wear one. And we're starting to learn more about which nursing homes in Mecklenburg County have an outbreak. Yesterday, the health department agreed to make that public in hopes of helping others. This is an issue that we here at Channel 9 have been pushing officials to do for days. And now we know where those active outbreaks are, and we want to show you. Take a look here at this map, and keep in mind an outbreak is defined by 2 or more people testing positive. These are the centers: Hunter Woods Nursing and Rehab Center, Huntersville Oaks, Pavilion Health Center in Ballantyne, Autumn Care of Cornelius, Carrington Place Rehab and Living Center in Matthews, the Laurels in Pineville, and the Social at Cotswold. Yesterday, our crews were outside the Social, and we saw people entering the assisted living facility with protective gear and masks. People who live there are being isolated, and meals are being delivered to their rooms. Unfortunately, one resident of that facility died from COVID-19. 14 other people who live there have tested positive, along with 2 staff members. Over at the Pavilion Health Center in Ballantyne, we learned 11 residents and 2 staff members have tested positive. We also found out that employees are being screened when they show up for work. County commissioners say this information is absolutely public, and the residents need to know what's going on, which is, of course, why we push so hard for it.
I think it's only reasonable that families are concerned. It's only reasonable that communities are concerned, and I think that providing more information is the way to handle it.
And we know one thing contributing to some of these outbreaks are workers going from job to job at multiple nursing homes. It's a common practice for a lot of reasons.
If you don't have the patience and the compassion, that job is not for you, because it is very difficult.
Teresa Moore has worked in long-term care since 1993 and says the already thankless job is now much worse because of coronavirus.
Probably having to work longer hours and with more patients, and yeah, I wouldn't want to be in their situation right now.
A situation she says was already bad enough.
You don't make no more than $22,000, $25,000 a year. You're understaffed, undersupplied sometimes with the supplies you need, and it's a lot of headache.
Moore ended up leaving care facilities entirely, moving to private in-home care to be able to make a living. But she says many don't get that chance. Instead, they have to add to their workload, taking on jobs in multiple care facilities just to make ends meet.
There would be a lady on 3rd with me. She would leave work in the mornings on 3rd, and she would go to another facility and work a first shift job. A
sad reality that's now having tragic consequences across the country. In Washington state, a CDC investigation into a nursing home linked to 37 coronavirus deaths found the sole cause behind the outbreak were workers going to jobs at multiple nursing homes carrying the virus with them.
The report will say that there were problems with nurses coming in. We've discussed this, nurses coming in and going to other facilities. Prior to this event, there had been no guidance from any agency telling us that that practice should be stopped.
That is a very common practice in our state for staff to work at 2 to 3 different long-term care facilities.
Lauren Zingroff is the executive director of Friends of Residents in Long-Term Care, a nonprofit that advocates for nursing home residents and their families. She says staff bouncing between multiple facilities won't stop anytime soon because no one's working to change the conditions forcing them to be there in the first place.
We do not currently have a living wage here in North Carolina, and they don't have health insurance either. I mean, it's not a choice. I don't think many of us would say we want to work 2 or 3 different jobs. just to get by. But that is what they're having to do.
So with nowhere else to go, employees are going to work, continuing to fall ill and creating even deeper staff shortages.
We are seeing staff that are sick and cannot come. We are seeing staff that are not going to work out of fear because there is an outbreak at their facility. And then what's going to happen then in regards to making sure that we have the right amount of staff and an adequate number to take care of all of the residents.
As for Teresa, she says, unfortunately, based on everything she's seen over the years, we will likely continue to see outbreaks in our nursing homes.
Because if you have patients that have tested positive and you're working around them on a daily basis and you're leaving there, going to another facility, then you're not going to contain it. It's just going to keep spreading.
And this morning, there are signs of optimism with this outbreak. So far, 58% of people have recovered. The death rate among Mecklenburg County's 1,136 cases is less than 2%. If you take a look at this chart, it tracks cases since the first one on March 11th. Now, at first, you see a rapid climb, but in the past few days, that started to level out. We're also starting to see some slight change in the racial divide. Earlier this week, the county reported more than half of its patients were African American. Now that has moved down slightly to 48%. But cases among the Hispanic community have risen to almost 13%. Health officials in Gaston County say they're trying to close the gap in services that might have led to that increased rate for the African American community. The plan is to turn mobile dentistry labs into test centers to go into African American communities. Health officials say long term, they have to open more options for preventive health.
We cannot ignore that. We have to address it and treat it appropriately. So what we'll do is build the infrastructure within our county.
Now, the plan is to use churches to help keep people in the African American community informed about resources available now and those that are on the way. Well, all new this morning, Channel 9 has learned an employee at the Kannapolis Post Office tested positive for coronavirus. The Postal Service told me it believes the risk is low for other employees at the facility, but it is monitoring the situation, saying safety and well-being of their employees is their highest priority. Well, pretty soon, people in North Carolina might be able to take COVID-19 tests right from their own neighborhood pharmacies. Soon, pharmacy drive-thrus could be used to administer the new test. It lets people know if they have antibodies proving they've had and fought off the virus. Lawmakers are working on a bill that would allow pharmacies to administer those tests and vaccines once they're ready.
You don't have to call and make an appointment. You just walk in a drugstore and they give you the vaccine and you go on your way.
People hopefully will come to us quicker than maybe even they would go to their doctor's office.
Now, the bill is still being worked on, but it could get presented sometime next week.